that there's two parts that we go through. We do person-centered reviews, PCRs, and provider discovery reviews. This next presentation and the PowerPoint that I'm taking you through in just a couple of handouts, it's a little bit shorter, will give you some information about what a person-centered review is with Delmarva. So if you're a representative who's looking at this, or a parent, or both, or a participant receiving services, hopefully you'll have a little bit of understanding of what a PCR is, the questions that we ask, why we ask the questions that we do, and how that process works. Again, the most important thing to emphasize with person-centered reviews is it's all about the person. It's up to them whether they even want to talk to us and participate in the first place, but should they choose to, this is the information I'm going to take you through about what that's a part of. If we can go to the next slide. So for a person-centered review, who gets reviewed and why? Who gets picked for PCRs? We annually, we just finished doing this in December for 2010, we're getting ready to pick our year 2 sample. And what we do first is we collect caseloads from all the support coordinator and CDC Plus consultants in the state. And there are approximately a little over 800 support coordinator CDC consultants in the state of Florida. We have our scientists, our Geek Squad team, who works out of our Tallahassee office. These are all the folks with statistics and PhDs and all this information that they need to know. And they take this information and they do a random sample. They put all the names essentially in a big hat, mix them all up, and for every support coordinator, we sample 2 names from their caseload list. If it's a support coordinator who is also a CDC consultant and they're serving people on CDC, we're going to sample from their CDC and from their waiver, or possibly in some instances just their CDC people. But that's how we get the names for person-centered reviews. Right now for year 2, we're looking at a sample size that is approximately 1,600 individuals that have been sampled for a PCR, person-centered review. So it is random when we pick these names. Who can participate? If you choose to do a PCR with us, it means that someone's going to be in touch with you. Your initial phone call will come from your support coordinator or your consultant. They're going to make the first call to you and let you know that you've been randomly picked for a person-centered review with Delmarva. There's a reviewer, they'll probably let you know who the reviewer is that would like to come out and meet with you. This is what it's about. At that important time, you're going to let your consultant or your support coordinator know, yeah, I think I would like to talk to that Delmarva reviewer. So at that point in time, we're going to figure out when we're going to do that. Who can be there at your person-centered review? It's, again, all about the person. Who do they want there? You might just want to talk with the Delmarva reviewer by yourself. You may choose to do it at home with your family. Maybe have your mom or dad there. You could choose possibly to have your consultant or support coordinator present with you for a person-centered review. It just depends. But the key part is that you decide who's going to be there. There will be points in the process that we'll have to decide who can answer questions, but you do decide who gets to be there. As far as scheduling and where the interview is going to be held, again, all about you. You tell us what's a good time for you and what's a good location. Many individuals choose to meet us at their home, so we might go out to their family home and meet with you in your kitchen, sitting around the table to ask these questions. As far as when we schedule it, when's a good time for you? Mornings, afternoons, evenings, we're going to work it around your schedule and find out what a good time is. A person-centered review on average is going to take about an hour to an hour and a half to complete the different questions and pieces that we have. This presentation I'm taking you through right now will go through each of the tools that the Delmarva reviewer will be using when they meet with you for a person-centered review. Next slide. So the tools used for a person-centered review, if you just hit the space bar a couple of times, are a National Core Indicator Survey, and we do the National Core Indicator Survey only for adults, for individuals who are 18 years old or older. With CDC Plus program individuals that we're meeting with, many of them are children. So if they happen to be a child, we would skip the National Core Indicator Survey. And I'm going to talk about each of these tools and tell you what they are and what's involved with them. There's an individual interview instrument that we talk with people about, health and behavioral questionnaire. These 3 parts are what we do when we come and meet with you personally. We go through those 3 tools. Each involves different questions on different topics. Some of them kind of overlap, but basically you're having a conversation and talking with us about things that are important to you. A PCR also includes, when we have a person-centered review with somebody, We also look at the records of the people that are their providers. For CDC Plus, a PCR, that means we're going to do a record review with your CDC consultant, and we'll do a record review with your representative. You can opt whether or not to talk with us as part of a PCR, but your consultant and your representative has to meet with us to review their documentation. And that was called a provider discovery review, and we talked about that in an earlier taping. So let's talk first about national core indicators. This particular tool is not something that Delmarva created. It's developed by a company called Health and Services Research Institute, HSRI. The state of Florida decided that they wanted to begin using national core indicators in the state of Florida to kind of measure how services are for people with developmental and intellectual disabilities. And it asked questions about quality of life and activities that people are involved in. It's currently being used by about 29 states to gather information about the lives of people with intellectual and developmental disabilities. It allows states, because the survey is standard and the same questions are being asked, and each of the people administering the survey, in our case Delmarva has been asked to do these surveys since we were already going out and doing interviews with people receiving services. They suggested that we go ahead and do these surveys for the state of Florida. So since the surveys are being asked the same questions, the same information is being collected, it allows the state to compare apples to apples, because everyone's being asked the same information. So if I'm talking to a person in the state of Florida about what community activities they're involved in and what relationships and things are important to them, similar questions, the exact same questions actually, are being asked by surveys in other states, maybe Massachusetts, out in Oregon, again 29 different states. Gives us a good picture as to what's happening here in the state of Florida and how does it compare to other states around the country. The data that's used from National Core Indicators, NCIs, is completely confidential. It is very much a survey. The reviewer will go through each of the questions, they'll let you know what the options for answering are, but that information is never tied to you specifically. Your name is never attached with those answers. All these pieces and answers in the questions get put together, and it helps give a picture here in the state of Florida, and HSRI can put out reports for the United States and the 29 states that are getting these to kind of compare on each of these questions what people's responses are. So it's very important that people know that it is completely confidential. If you've agreed to do a person-centered review, even though you've agreed to meet with us, doesn't mean you have to answer every question that we ask. You could say, I don't want to answer that one, or pass, or I'm tired, I don't want to answer anymore. You always have the ability in the process of meeting with the Delmarva reviewer to kind of make those decisions. National Core Indicator surveys, the survey is broken up into two sections, and I just want to clarify the differences between the two sections. First off, you have Section 1. The Section 1 covers employment and other activities, so they're going to talk about whether you work, do you have a job, do you not have a job, if you're not working, do you do volunteer work, do you go to a day training program, what are you doing kind of as your employment and other activities. Learn a little bit about your home. Do you live with family, do you live independently, what's your home situation. Safety and health, friends and family, satisfaction with the supports and services that you're receiving, and are you in something called self-directed supports, which is very much related to what CDC Plus is. It might be called other things in other states, but different states have different choice and control programs, programs that put more autonomy and freedom among the family members in budgeting and choosing their services. That's what CDC Plus does. So we might reference and cover questions on that. What's very different with the Section 1 is the questions have to be answered by the person who is receiving services. Now, some individuals, because of the nature of their disability, might have different challenges with communicating. Some individuals use words to communicate. Others have facial expressions or gestures, might be sounds. They might use sign language. They may even speak another language. Typically, before we go out to do a person-centered review, we're going to find out a little background information. We're going to talk with your support coordinator consultant and find out what's your communication style. If you happen to be someone who uses Spanish, Spanish-speaking individual, or you use sign language, we would arrange to make sure we have somebody else there who can interpret. Also, understanding your communication style just helps the reviewer be prepared to be able to gather information from you. For Section 1, the information can only be answered by you. If the reviewer will typically ask a question, and the answers will be yes, no, don't know, sometimes, in between. There's also a code that the reviewer could mark where a person unable to answer or doesn't understand. So it could be that in section 1, some individuals might be able to answer all our questions very well. They're very outspoken, they use words, they tell us everything that we need to know. Some individuals have disabilities that are a little bit more pervasive, that are more involved, that have affect their ability to kind of understand and maybe use words. We might not be able to cover the questions in section 1, but nobody else can really answer these questions. That's why we have section 2 in the National Core Indicator Survey. So when they complete section 1, all those answers are done, the reviewer moves over to section 2. What's different in section 2 is if you have other people there with you, your mom or your dad, other people who know you well, friends of yours, they can help provide some information on your behalf. Ideally, it's a person-centered review. We want to hear from the person who's getting the services. But section 2 allows other people who know that person well to answer on your behalf or to help you with answering questions. The topics that are covered in section 2 include community inclusion, choices, rights, and access to needed services. And they get very specific. I can tell you in doing the community inclusion one, folks have asked, well, why is the reviewer asking that? Or why won't they let other people answer? This is why. They've been trained with the National Core Indicator Survey to follow very specific rules when they're doing this. In community inclusion, they're going to ask very specific questions. Do you go shopping? If yes, how often do you go? Once a week, twice a week, once a month, 2 times a month? Who do you go with? Is it family? Is it friends? Is it a staff person? A caregiver who takes you shopping? Do you go to church? Who do you go to church with? Again, pretty specific questions. And some people are asking, well, why are you asking all that? The survey designed by HSRI is to gather a lot of information about people in their lives and what they're doing, and will help give us a pretty good snapshot on how things are going for people. Once the reviewer finishes the NCI, they're going to say, I'm done with this part. They're going to close up their papers and kind of put it to the side. Because as I said before, any of the information or questions asked here is confidential. So we might repeat ourselves later on with some questions that we're going to ask using the next 2 tools.